start to learn long channel and tie-in. We mentioned the channel system. So we will discuss every single channel, totally 14 channels, right? 12 regular one and 2 extra one, okay? So the items we want to cover is channel pathway and channel discussion, longs function, just review. We learn from foundation, right? And the channel actions and indications and the individual points, right? Okay, we go to the next one. So long channel the pathways include the long primary channel pathway and the long connecting channel and the long divergent channel. I still have the long sinew channel. Here seems like a muscle region, right? Yes, seems like this. Here's the long system, right? Long system we mentioned before include the primary channel, connecting channel, sinew channel, or sinew or the muscle region or the skin region stuff, right? Okay. First one let's watch some video, from Peter Deadman. He did a very good job. Perfect. Let's just a quick review. Just go to next slide. Show primary channel. I want to repeat too much, but you just know that it start from middle jaw. Start points. Finally, to descends. To connect the large intestine channel organs. Allied organs, large intestine organs. Then the retains upward pass through cardiac orifice of the stomach and transverse diaphragm. And go to penetrate the lungs, ascends to throat regions. That's why the lot of throat problem. First, we think about lung, right? Passes obliquely down or toward the zhongfu, surface body, and where the channel emerges, right? Emerging. Then go to from that, it down descends along to the anterior lateral aspect of the upper arms and lateral to the heart and the pericardium channel. We know the anterior media, right? And reach to the long 5, right? The Qi and pass along the anterior lateral aspect of the forearm towards the stylo process of the radius. And follow lateral border of the radius artery to the wrist at Taiyuan, long 9. Transverse to the sinew eminence to the terminate at the radial side nail at the Shaoshan, long 11, totally 11 points. Still branch, we know the branch long 7, right? Remember that from long 7, this branch just run distally toward from stylo process and then run reach to the radial side of the tip of the index finger, right? Connect to the LI1. That's right there. It connect to the large intestine channel, okay? Now the long primary channels connect with the following zangfu organs. Remember that is stomach, large intestine, and the lung. From the channel itself, it not only just pass through the large intestine and the lung, still stomach. So long primary channel meets with other channel at the following points. No special points in long primary channel with other channels because it connects from the tapes, from the fingertips, yeah, with the exterior channel, yeah, pair up, yeah. Next one, luo-connecting. Luo-connecting typical you watch the video, you know that separated from the long 7, 列缺, and follow the long channel into the palm, and spreads through the thin amnios. And okay, come back. Connect with the long channel, interiorly, exteriorly related large intestine channel, right? From there, large intestine channel is number 1 in the index finger, then run toward the head, right? Lung divergent channel, divergent from the lung, primary channel at the axilla, and passes anterior to the heart channel in the chest, and connects the lung and disperses in the large intestines, right? Divergent channel. Here no special points on the divergent channel. Just tell you, strengthen the connection between interior exterior channels. A branch ascends from the lung, emerges at the supraclavicular fascia, ascends across the throat, and converges with the large intestine channel, right? It strengthens the connections. Long sinew channel. We know long sinew channel follow the same pathway of the primary channel, just we look at it wider because it's muscle. So originates on the thumb, right? It's from the distal to proximal. So originates on the thumb at Shaoxiang long 11 and ascends to bite at the sinew amnios, follows the radial path and ascends to the flexor aspect of the forearm to bound at the center of the elbow, and continues along the anterior and lateral aspect of the upper arm to enter the chest below the axilla, right? Emerges at the region of the trypan, stomach 12, and travels laterally to the shoulder, anterior to the ali 15, right? Ali 15 is still important points for the shoulder pain. Retains to the supraclavicular trypan stomach 12 region and descends into the chest, Okay. Number 6, spreads over the diaphragm and converges in the region of the floating ribs. This is just a very brief discussion. The two relationships, long channel of the hand tagging is paired with the spleen channel of foot tagging according to 6-channel series. 6 pairs. We mentioned before, 6 pairs based on the yin-yang name, right? Those are called tie-in. Just one is hand tie-in, one is foot tie-in. And the interiorly, exteriorly related with the large intestine channel of hand yang according to the pertaining and the linking relationship, right? Large is long intestine channel relationship. It's further strengthened by the facts. Okay, what are the facts? The interior passage of the long primary channel descends to the large intestine full organs, right? A branch of the long primary channel separates from the 列缺 long 7 to connect with Shangyang, LI1 point. Luo-connecting channel connects with the large intestine channel. Yeah. From the point, it strengthen connection. Still have the luo-connecting channel, right? Strengthen the connection. The long divergent channel descends to the LI2, large intestine, and connect with the large intestine channel in the. So, in addition, it is helpful to note that the long primary channel originates in the middle of jaw, in the region of the stomach. The long primary channel and the divergent channel ascends to the throat. A lot of long, throat problem, we can take a long channel points to treat, even the large intestine channel points. So the long channel does not connect directly with the nose, but it does. So indirectly via the large intestine channel, right? Yes. So here we have lung has a 5% function. This is from the foundation of the TCM, governing qi and controlling respiration. You know that, right? You know that. And next one. So next one is a controlling disseminating and descending, right? Controlling disseminating and descending. Sometimes disseminating called disperse, right? Descending like descending qi, disperse qi, right? And the next one, regulating the water passage. You know that, right? Water passage. Don't forget about this. Lungs still have the function regular water passage. Water body fluids. It's through sweating. Sweating. Yeah. And number four is controlling the skin and the body hair. A lot of skin disorder we think about the lung channel points and the lung system points, include the bacterial points, right? Body hair. Number five, opening into the nose. Of course, a lot of nose or nasal disorder, we can think about lung channel points. Also include the lung intestine channel points, right? Okay. And the chief pathological manifestation of the lung organ and the channel. It's just all for the lung disorder. But still think about two big categories. One is lung organ disorder. Lung organ disorder, like cough, asthma, shortness breath, chest distension, and the fullness of him, fullness of chest, in the chest fullness, and hemoptysis, cough the blood, cough the blood. Number two, the common cold, the sore throat, and the stuffy nose, right? Number two big is the lung organ disorder. Lung organ, right? Lung organ. It's lung organ. Remember, lung organ disorder. And still have a lung channel disorder, right? Lung channel disorder include a lot of pain, right? In the superficial, in the supraclavicular fossa, anterior border of the medial aspect of the arm, and the cold pain in the shoulder and back. It seems like a lot of muscular problem, soft tissue problems, include muscle nerves. Yeah. Next one. Lung action indications. Still continue lung action indication due to the above organ function and the channel pathways discussed. Many of the action indications of the points of the lung channel can be explained, right? If you talk about individual, the acupoints is more functions, a lot of functions. Okay, these can be summarized as the two big categories. One is disease of the lung, chest, and throat. Number two, disease of the areas the channel supplies. Yeah, same like we understand like a muscle problem and nerve problem, and some maybe sometimes is small vessel like capillary problems, right? So, actions indication of long points is very wider. It's very wider because long points still have 11 points. So now, number one, treating the rebalance of the lung qi, as respiratory disorders such as coughing, dyspnea, wheezing, asthma, and shortness breath. And then number two, restoring the lungs disseminating function, disseminate like disperse, right? When this is impaired by exterior pathogenic factors which lodge in the superficial portion of the body. We know catch cold, a lot of febrile disease, fever, the person fever, cough, right? Lung infection. Number three, treating the nasal disorder, including nosebleed, nasal obstruction. This is very common, nasal problems. We think about lung channel bones. Of course, still combine some large intestine points, right? Channel points. Number four, treat skin disorders. Of course, lung channel point, treat skin disorders. Especially, you can use lung saving, right? Lung saving, and still lung shoe, back shoe points. Number five, treating disorder of the throat, such as dryness, soreness, congestion, swallowing, and pain. Number six, treating edema and obstructed urination. When this is caused by the impairment of the lung function of the regulating the water passages. Water passages, that is through the sweating pore, and the controlling, disseminating and the descending. Yeah, descending. Yeah, some points can really promote sweating and perspiration. Okay, number seven, treating vomiting due to the rebalance of the stomach qi. Yeah. Next one, individual points. We will cover number one, name, pinyin name, Chinese name, and still code names, right? International code. Nature important. We talk about special points, about totally these 10 category special points, right? Some points have this kind of nature, some other point has other nature. Location important. Top detail based on anatomy, based on professional term. Number 4, needling. We just briefly introduce, yeah, because needling future you learn more. And the precaution still so important. Safety, right? And the function application, basic functions and basic actions, and still brief clinical applications. And the combination. This part of combination, we just give you a little bit, some to introduce limited information because we don't have too much time. Okay, number 1, long one. Long one important, long one special points belong to the special points. So called the Zhongfu, middle palace translation, middle palace. The nature is friend and mu. Remember friend and mu. Friend in the body friend. Mu is gathering and converge, something like that. The energy, right? Long channel. And still crossing point the long and the spleen, right? Long spleen. How to locate the points? Location like on lateral aspect of the chest at the level of the first intercostal space. First intercostal space, and the sixth twin lateral to the middle, right? One twin inferior to the yun mei, long 2. But for here, we have to locate, yun mei first, right? Yun mei, typically based on the inferior border of the scapula, right? Inferior border scapula. Based on here, inferior border scapular. And here, important, there is the triangle, we know that, right? A deltoid pectoral triangle, between deltoid muscle, big muscle right here, and then still chest, pecs muscle, is right here in the corner, right triangle. Based on here, you find the long 2 first, then 1 twin inferior, you find the long 1. Yes. Okay. It's so needling important because here not so much tissue, it's just oblique and still has a risk to cause pneumothorax, right? Don't puncture so deep, puncture shallow. Half twin and 0.5 and 0.8 twin, yeah, half twin, lateral, okay. Commonly just oblique means oblique. Your needles don't perpendicular. It's oblique safe. Run in the tissue, not run inside the cavity, right? Yeah. Okay. So actions. Number 1 action regulate and descending lung qi, stop cough and asthma. Yeah, we can use often. You can use needles. Sometimes you worry about needle. You can use little cupping. Yeah. Little acupressure still okay, right? They can treat the cough, asthma, dyspnea, the shoulder, or the upper back pain. Shoulder, upper back pain related to the muscle, right? Local muscle, because deltoid muscle involved, the pecs muscle involved. Number 2, disperse fullness from the chest and the stop pain. Disperse fullness still regulate descending lung qi, right? And still chest pain, if chest pain, a lot of time because of some muscle, right? Sometimes because maybe the visceral membrane of the lung, or maybe some parietal membrane of the chest, right, of the rib cage, yeah, the soft tissue. For the chest pain and fullness due to excessive heat or phlegm, yeah. So lung 1 important. But right now we use a lot for sometimes use the shoulder pain, sometimes use the common, chronic cold, cough, right? So note, never puncture deeply toward the media aspect, okay? Belong to no special points. Not a special point, just common points. We just already know that. You may like a cloud gate. We just introduce briefly. Yeah, because this one not so important. Also important. Okay, a little bit. Let me check. Oh, now actions. Okay, you can continue. Maybe just. Okay, location important. Previously we mentioned locate the clavicle bones, 6 twin away from midline, 6 twin. Here show very clear, 6 twin. From midline, similar to chest bone right here, to the measure 6 twin, right? 6 twin, right here. You get points, but still from long 2, 1 twin inferior. You get 6 twin from, scapular right here, Just inferior border scapular get long 2. 1 twin inferior get long 1. Yeah. So location right here. Inferior in the depression below the acromial extremities of the clavicle, and 6 twin lateral to the middle lines, the front middle line, in the center of the hollow of the deltoid. Remember deltoid and the pectoral triangle. This right triangle right here, the muscle triangle. The pecs border right here, deltoid muscle right here. You see the clear so good, very, very good. This picture show the deltoids, right? And this pec muscle right here. Yeah, right here. Okay, great. So go to next one. Action indication just a little bit, very similar, but a lot of time we use zhongfu mo, disperse the fullness from the chest, right? Painfulness in the chest and shoulder, upper arm pain, local application. A lot of no, if not a special point, a lot of time local application, local clinical use. Number two, stimulated the descending of lung qi and stop cough. This number two not so important. For the cough, we think about the zhongfu first, lung one, because it's front move, special point for the lung. Okay, cough asthma. Yeah, that's just we can skip quickly. Still same, right? Risk, just precaution, just same, and never puncture deeply toward the medial aspect, right? Control the depth. Yeah, lung three, Lung three, like Tianfu is same like palace of the heaven. Yeah, Tianfu, yeah, palace of heaven. Translation. Nature is the point of the window of the heaven. Point of window of heaven still. His book has summarized a lot of point of window of the heaven. Yeah. Asian people believe, the body, can absorb energy from universe, right? It's so the kind of point of window of the heaven. Yeah. So location on the medial aspect of the upper arm, switching below end of the axillary fold, and the 6 string above the chisel long 5. In the depression between the lateral border of the biceps muscle, brachii, biceps brachii muscle, and the shaft of the humerus. So this one we know that, you learn just three measurement, proportional measurement from the axillar folder, axillar crease to the cubital crease about how many twin? 9 twin, right? 9 twin. Here's 3 twin, right? 3 twin, below, right? And also from here, the tendon biceps, from the we talk about the long 5, here is about 6 twin, right? Because 6 twin above chisel, right? 6 twin plus 3 twin, 9 twin. Yeah. Needling is this one safe, no risk of puncture lung, but perpendicular, we can do P, perpendicular, P is perpendicular and is perpendicularly. Yeah. I don't have the surface pin. Surface pin don't working well, but I use mouse, not so good. Yeah. Yeah, just vertically. Okay, vertically. Same like this picture too. 3 twin, 6 twin, right? Chisel, right? Look at this. This section a lot of times just local. We don't need to talk too much. Actions: clear lung heat and descending lung qi. Lung heat, lung qi. Asthma, cough, dyspnea, much speed, this one seems like a lung heat pattern. Yeah. Number two, cool the blood and stop the bleeding. So this could clear lung heat. If some blood, some bleeding, cough blood. If the lung, heat cause, coughing blood, we can think about this point, lung 3. So it's a nasal bleeding, spitting, and a coughing blood, right? And number 3, call the comparative soul pool, right? Irregulation means, right? Emotional problems and derived from lung problems, some lenses, because lung, we know sadness, sorrow, sadness, depression. You can think about, lung 3, regulation. Yeah, we often use this point, regulation. Yeah. Number 4, lung 4. Still not special points. It's called 狭白. It's clapping the white clapping the white, 狭白. I think it's just based on the local anatomy, the name, right? You look it up, 下摆, right? It seems like, medias are much more, the color is lighter, you call it white, lighter. So 下摆. So it's the location, yeah. On the anterior medial aspect, the upper arm, 4 twin inferior to the axillar fold, 5 twin superior to the chisel, right? In the depression between the lateral border of the biceps brachii muscle and the shaft of the humerus, So this body surface for the light person, and still Peter's book is so the, still you can find the long 3, then 1 twin inferior you find the long 4, same as well. If you palpate, you have to find the bicep muscle, the lateral border, the point between the gap, the gap, the gap between the humerus and the biceps muscle. Yeah, remember, important gap. A lot of point in the gap. They call it, the hole, right? Yeah. So it's point. Actually, not a real point. It's a hole inside the body. 下背. Next one, it's some insertion. Tell you the needling. What's needle? Goes through different tissue layers. Needling just a propeller system like a long 3, right? Half twin or 1 twin because there's no risk of damage lung. It's okay. Here from the Claudia Adler's Claudia Adler's acupuncture book, you can picture very clear. Yeah. Actions, indications. Actions, disperse lung qi, descending lung qi, treat all cause, treat and cough, fullness in the chest. Number 2 is regular qi and blood in the chest. So it's still regulate the soft tissue problem, the pain in the medial aspect of the arm, right? The muscle problem, right? Muscle maybe still nerve involved. Yeah. Long 5, these special points. Yeah, we talk a little more. Long 5 called it 尺泽, cubit marsh, still water body, right? Cubit or cubital marsh. Hersey point. Hersey point is so important, right? With 5 points, the last one is Hersey point. Location. On the cubital crease, on the radial side of the tendon muscle biceps brachii, this point is located with elbow slightly flexed, elbow flex. You can find the point easily, right? Same like this picture from Peter Deadman, manual acupuncture, yeah. And you get this one, choose the right? You find bicep tendon, important. Yeah, here. Yeah, perpendicular. This one very clear with the model body. You see, very clear model body. You can see clearly right here. Biceps tendon right here, right? So needling just perpendicular half twin, 1 twin, no problem. Yeah, sometimes even the big guy you can go to 1.5 twin, even 2 twin. Depends body type, still important, right? So go to next. And then the actions, long 5 is big point, a lot of actions. Number 1 is clear heat and resolve the phlegm from the lung. Clear heat, resolve phlegm. So it's a big point for the cough problems, right? So it treat sore throat, fullness of the chest, sore throat. And still number 2 stimulated the descending of lung qi, right? Descending lung qi. So cough, typical can treat cough. Asthma, spitting, blood, and coughing blood and nose bleedings. But this bleeding maybe not so accurate. It's middle kind of chronic. Accurate thing about lung 6. Next slide, talk about lung 6. So number 3, regulate water passage and benefit the bladder. The lung, the function. Lung has one function to regulate the water passages, right? Remember this. So still benefit swallowing of the forelimbs and, in uresis, frequent urination. Yeah, for the maybe children, maybe all senior people. Yeah, can think about choose. Number 4, relax sinew and elevate the pain. This one typical treat soft tissue injuries. You can treat infantile convulsion, epilepsy, spasm pain, and restrict movement of the shoulder and elbow, arm, and hand. You can benefit local. But the Chizu, another I mentioned 2 important use. Chizu really can benefit the knee joint pain, right? Knee joint pain, especially corresponding knee joint. right? Knee pain, right? Knee pain. Especially countries, the contralateral, right? Right treat left knee pain. Left treat right knee pain. Yeah. At the same time, of course, you can ask patient do active movements. At the same time, it's get the best result. Also, the children is good for the stroke rehabilitation. Stroke patients, stroke, stroke patients, rehabilitation, right? Stroke patients, yeah, stroke patients. Okay. So the new applications, just tell you that, yeah, tell you that. Long 6, 孔最 from name, maximum opening, maximum opening. Asian people really know anatomy. Asian people know anatomy. Uh, It's based on their palpation. Follow the muscle on the forearm. You can find really between the two muscles. You can find the big space opening. They call it. So the nature is C cleft. We remember that C cleft for the yin channel really can treat acute bleeding. Acute bleeding. Yeah. So bleeding for the lung system is cough blood and the nasal bleeding. Right. So location on the primary aspect forearm. Right. Primary on the line joining Taiwan, long 9, and the Chizhou, long 5, right? It's a big, long 5, long 9 is still big point, but still big landmark, right? Have you located points? Have you located points? The draw lines, 7 twin above the transverse crease of wrist, 7 twin, right from here, transverse, crease of the wrist, 7 twin. Yeah, totally how many twin in the forearm? 12 twin, right? 12 twin. So, right here, needling, perpendicular, half twin to 1 twin. Yeah, it's because on the arms, it's okay, it's safe. Long 6, long 6. We can see more pictures from Adler's acupuncture, long 6, long 6. Remember 7 twin, yeah. So actions regulate and descending long qi, of course. For still can treat acute cough, acute excessive condition, cough, asthma, and chest pain, acute cough, especially some episode, panic, onset, asthma include, 空坠. Number 2, clear heat and stop bleeding. Yeah, what kind of bleeding? Sore throat, loss of voice, yeah, bleeding, the coughing blood or spitting blood or the vomiting blood, even nasal bleeding still okay. Nasal bleeding, yeah, you can add nasal bleeding. Okay, number 3, activate the channel of stopping. Of course, still benefit from local, right? Local application channel. Spasmodic pain of the elbow and arm. Sometimes just because muscle tension, muscle trigger points. Yeah, long 6. Next one is the long 7. Long 7 we mentioned before, right? Luo-connecting, big one. We mentioned several times. 裂缺 means broken sequence. Broken sequence. This is very manifold. I know Asian people know anatomy. The broken sequence seem like stylo process. The bone, you can feel that this bone surface is not flat, not flat. You can find the features, the small depression is very tenderness and very tender, right? We call it broken sequence, 裂缺. Nature, number 1, luo-connecting points. Luo-connecting point. Number 2, still remember number 2, confluent points. Long 7 is a confluent point of ring channel, right? Ring channel. But still have number 3. Number 3 didn't mention right here. I can give you number 3. And number 3, like still you could not write. Okay, I have to use this one. Yeah, use it a little bit. Number 3 still they call the command points. Command. Command chief, like command, right? Command. Because in the 366 points, how many command points? Total only 4 command points. So long 7 is one of the 4. So very precious, very powerful, very common, So the location on the radial aspect of forearm, approximately the 1.5 twin proximal to the Yangxi. Where Yangxi need to find it. Later on we talk about Yangxi, Li5, the large intestine channel point. Sorry. In the cleft, between the tendons, especially, you can find the bony feature. Also, you can find the gap between the tendon. What tendon? Two tendons. Brachioradialis. This muscle. Brachioradialis muscle. You know, this muscle sometimes we call the drinking muscle, right? Cheers, right? Brachioradialis. And still, abductors, pollicis longus, pollicis longus. Yeah, we look at here. Yeah, right here. Because on the style person, no, yeah. I give more pictures. Yeah, these pictures show very clear, right? Long setting right here. Yeah. Common twin, how many twin? One and a half twin. Yeah, but best to based on the palpation, based on the local body landmark, right? And still oblique, right? Oblique, because here not too much muscle, right? Just very thin skin, then you find the bone, right? So oblique, outward, 0.3, 0.5 twin. It's shallow, not so deep, not so deep. Okay, here tell you the two muscle. We know that. Remember the two muscle: brachioradialis and the adductor pollicis longus. The two muscle right here. Adler's acupuncture marks so well. Displays so clearly. And still another, be very brief. We call quick measurement, find the points. Just cross hands, find the points on the starter process. Right? So cross your own hands, okay, right? Own hand. Your index finger, the tape, reach their location. Okay, you got it. On the starter process, you find the long seven. You find the long seven. Okay, actions. Number of action, expel, expel wind and release exterior, of course. 裂缺 is a long channel point, but it still connect to the large intestine young channel. So it can expel wind and release exterior. And number two, stimulate descending and dispersing the lung qi, right? Of course, is treat cough, asthma. Number three, pacify the wind phlegm, 风痰. It's a wind phlegm we call the 风痰 in pinyin. 风痰is really benefit, the dizziness, right? So number one, for number one action for the number one indication, the exterior syndrome with chill, fever, headache, stiffness on neck and back, sore throat, congestion, and the discharge of nose. Something like common cold, right? Common cold. Number two, right? Chronic cough, whatever chronic cough and acute cough, both okay. Asthma, dyspnea, and still three, facial paralysis, epilepsy. 风痰is about facial paralysis, nerve damage, but TCM is saying about the wind phlegm. This kind of like but this wind is referred to the internal wind plus external wind. Yeah, both. Okay. So next slide. Yeah. It here still have number four actions. Number four action because these special points have three natures. Number four, open and regulate the ring channel. Of course, it connect to the ring channel. Remember that? I tell you combination. Long 7 with Ki6, a good combination. So with jaw high, long, Ki6, jaw high Ki6, long 7 is beneficial for chronic asthma due to the kidney deficiency and edema of the face and the menstrual problems and the dry sore throat derived from kidney deficiency. So this good combination is really can nourish yin, especially kidney yin, lung yin. Yeah. And still benefit, is really benefit regulation. Okay. And then number five, regulate water passage. Edema, urine, retention, and constipation due to the lung dysfunction. Really can descending lung qi, promote bowel movement, and still regulate water passage. Number six is activate the channel and stop pain, the local application, channel application, the pain and the weakness of the wrist and the hand. Right now it has a lot of tendinitis, especially can happen to the brachioradialis muscle. Brachioradialis muscle tendinitis use a lot. A person use a lot to do the sailor, do the typing, work so hard, get injured tendons, Okay, next one, lung 8. Lung 8. We call it Jing Qu. It's channel ditch. Channel ditch. Still like a different water body. This Qu, ditch, right? Okay, nature. Remember Jing River. Yeah, 5 point. We learn Hersey, right? We learn Hersey is number 5, right? Jing River is number 4, right? Jing River, Long 8. Long 8, where's the location? How to locate? one twin above the transverse crease of the wrist in the depression on the lateral side of the radial artery. Remember, radial artery, and still remember the twin. Palpate find the radial artery. Yeah. So we look at the picture right here. It show you 列缺, right? One twin above transverse crease of the wrist. One twin above, very straight. See right here, one twin. Another one twin 进去. Okay? It tell you how to needling. Yeah. And needling, the perpendicular, you can do perpendicular, 0.1 twin and 0.3 twin, very shallow. Because here, wrist, there is no much tissues, Caution, avoid radial artery. Yeah. Here, this picture show very clear, right? Here show artery, right? This, right? You saw this artery, side artery. You have to palpate to find artery, Here the tendons, right here tendons, but here the one twin away from wrist crease right here. Yeah. So what's the action indication? Actions. Number one action, descending long chain elevates the cough and asthma. Of course, 进去 is the Jing river point. Of course, benefit the organ. Yeah. Number one, benefit organ disorder. Cough, asthma, pain in the chest and sore throat, organ disorder. And still benefit the channel disorder. Activate the channel and stop the pain. Right? The pain in the wrist, local application. Yeah. Okay. Next one, the long nine. Long nine still special points. Yeah. Okay. We call it 太渊. The translation is great abyss. Still the water body type. Different type water body. Nature. So many nature. This one. Nature number one. Shoestring. All right. Shoestring point, remember that, right? It benefit heaviness and benefit pain, right? Yuan prime, yuan source point, yuan qi, can boosting yuan qi, can boost yuan qi. And still influential point. Remember how many influential points? 8. Influential to what tissues? Vessels, especially artery, right? Because this close artery. Location. At the radial end of the transverse crease of the wrist in the depression on the lateral side of the radial artery, between the tendon or abductor, pollicis longus, and the radial artery. Level is Shenmen heart 7. Shenmen heart 7, on the heart channel. This one long channel. Long channel is Taiyin heart channel is Shaoyin. So both medial side, but heart 7 is on the most posterior. This one is the most anterior, right? So look at the picture, right? How to locate and find the wrist crease, right? Wrist crease, radial side. And still find the radial arteries beside lateral side radial artery, not the medial side. Look at the picture. Look at the picture. It show your artery here. The Peter show the red line is artery, so it's the lateral side, not the medial side, not here. Okay. All pictures show, yeah, beside artery. Saw the needles, yeah, beside artery. And still we look at this one, beside artery, yeah. Right, long 8 is the one twin of it, is beside artery, lateral side artery, right, artery, yeah. Right here, long 9, yeah. So the needling, perpendicular, of course you can do perpendicular, a lot of time just shallow puncture, shallow insertion. 0.2 twin, 0.3 twin, right? Avoid radial arteries. Don't puncture radial artery. Don't damage. So tell actions. Number one, resolve the phlegm, especially long-term chronic, a lot of phlegm, right? Feel sticky phlegm in the chest, in the throat. Number two, 25 long qi and long in, regulate the long qi, stop cough. Yeah, okay. And number three, 25 zhong qi. Yeah, Taiyuan long night, good point to 25 qi energy, right? Number four, promoting circulation blood and influences the pulse because they are closer to the artery. Yeah, so number one, resolve the phlegm. You can find indications and the spitting and the coughing in the blood due to the phlegm, right? It really can benefit the cough, resolve the phlegm. Number two, 25 lung qi, lung yin, both of them. So treat cough, asthma, dyspnea, sore throat, lung qi, and the yin deficiency. The cough is deficient hepatic cough. Asthma as well, dyspnea, you remember, is deficient type, include qi deficiency and yin deficiency. Number three, 25 zone qi. Sometimes person have the palpitation because zone qi is include the function of the heart and the lung both. So you benefit zone qi still benefit not only lung but also the heart. So can treat the palpitations, the chest pain, and the cold hands with a weak voice. Right. Number four, promote circulation of blood, influential sees the pulse. Right. There's really no the closed artery. Lung nine is the influential points of the vessels, so it benefit the artery, benefit blood circulation. But typical treat the Parley syndrome. Next one is the long term. Long term, the name we call it 预计, fish border. Fish border, we know that, right? Yin spring, right? Look at location. On the radial aspect of midpoints of the first metacarpal bone, on the junction of the red and the white skin, between the first metacarpal bone and the thenar muscle. The thenar muscle. Thenar muscle is thenar eminence muscle, right? Okay, look at the pictures. Yeah, you find it. Thenar eminence muscle, you find the first metacarpal bone. Between the muscle and the bone, you find the points. More pictures like this. Yeah, this clear. So you find the midway, in the metacarpal bone, first metacarpal bone. So it's between the muscle and the bone. You find the space, find the points. More picture. Yeah, this one is more clear. Atlas acupuncture, right? Needling, perpendicular, of course, do the perpendicular. So you can just apply needles just beside the bone, between the muscle and the bone. So the depth is 0.5 twin and 0.8 twin, right? Yeah, long term. Actions, long term, we know there it's yin spring points. A typical clear heat. Remember that clear heat and benefits throat. Heating in the lung system. Number two, activate the channel and stop pain. So indication. So dry throat. So dry throat, loss of voice due to excessive heat, or the winter heat and pain in the palm and the thumb. Heat, lung organ and the lung channel. Number two, activate the channel and stop pain. What kind of pain? Pain happen to the channel system, happen to the elbow regions, or the through this arm. Yeah. But I'll give you another new one. It didn't mention so much in the textbook. But here longing, around the longing around, maybe not little difference, but you can palpate find sometimes it's very hurt, especially patients with frozen shoulder. You can use the point. Yeah, longing, treat the frozen shoulder. Closer longing, closer to the longing point. Last one is the long 11. It called the shao shang. Shao shang is lesser shang. Shao is lesser. We know we have a shao yin, shao yang, right? Yeah, lesser shang. Shang means music. In the music, read to the music long. And the nature is Jingwell points. Number 1 point in the five shu, right? Location on the radial side of thumb, about 0.1 twin posterior to the corner of the nail bed, at the junction of the lines drawing along the radial border of the nail and the base of the nail, right? Look at the picture. Very straight, very easy to find it, right? Shaoshang, long 11. One more time, here's this picture, yeah, from Peter's book. Next one, and Atlas acupuncture, very clear, right? You find the bottom line, to find the border, right? Same like the medial border of the nail bed, right? You find two lines cross, get 1 point. So needling, if you use, we call the filiform needle, it's perpendicular 0.1 to very shallow, or maybe use 3-edge needles, just prick to bleed. Prick to bleed is really good for the heat, especially person suffer very sore throat and feel throat is very swollen, right? Right away, especially for children, right? Especially children, just right away prick to bleed. Right away, the patient, the children feel relieved. At least 50%. It's very quick. So actions. Action number one, right, expel wind. Of course, treat wind cold, you know, cough, asthma, and fever. Catch cold, common cold, cough, asthma, fever. Number two, clear heat, benefits throat, especially sore throat, especially for the children, teenager. Number three, open the orifices and promote resuscitation. You know, just rescue patients, lose the patients who lose consciousness, right, in the coma, right? Of course, it's very hurt. Rescue patients sometimes hurt, and wake up patients, right? Apoplexy and loss of consciousness from the wind stroke. Wind stroke is a stroke, stroke. We know that. Hemorrhage, the brain hemorrhage and some the stroke because ischemic, right? Stroke. Yeah. So whatever, when the patient lose consciousness, think about this, lung 11. Of course, you can add other Jinwell points, yeah, together, strengthen the effect. So the case is just for reference. You can read by yourself. Right now, I don't ask you more about the case. This just give you some reference. In my case, yeah, in the clinic. So summarize. Nature function of the 3-4 star acupoint, visual points. So it's lung 5. Hersey point. Hersey point. It have function. It's just short form. Help you resolve phlegm for the lung, clear heat, and stimulate descending lung qi, and regulate water passages, and benefit blenders, and still benefit critical crossing point, and it's still and I think this one the lung 5 still benefit the channels, right? Treat the pain, elevate the pain, right? Like benefit the channel, elevate the pain. Lung 7 as well. Lung 7 as well. It just we listed before. Help you memorize lung 9. Okay. And see here summarize. Just from almost all the lung points, it's special points, except for we know the lung 2, lung 3, lung 4, right? The lung 5, lung 6, right? Lung 7, lung 8, lung 9, lung 10, lung 11. But future still learn backshore points. UB13. UB13 on the UB channel, the blended channel, right? You will learn future. Okay, guys, I think we finished all the long channel points about 1 hour. About 1 hour. I think I just still you guys can download handouts. I just posted later on for the long channel acupoints the table. I summarized, have you memorize, have you memorize. Okay, let me just stop recording. Hope everybody safe. I wish everybody safe and wellness, stay safe, stay wellness. Okay.